With non-communicable diseases on the increase, the young generation is said to be at risk of heart problems, with malfunctioned heart valves being top on the list.
You have to remember that in Kenya alone, the number of people who die from valvular heart disease is significant. There are many people, usually in their 20s and 30s, who develop severe and advanced heart valve problems, and there is nothing that can be done for them except for a valve operation.
However, with only 4 years of existence, the Aga Khan Heart and Cancer Center has put Kenya in the limelight by successfully carrying out a heart valve replacement with the latest technology that has only been in existence for 10 years now.
Is that there are only 2 or 3 countries in Africa which now have approval for this, and Kenya is now the 3rd, perhaps a 4th. There are 2 centers in North Africa and there's South Africa, and between North Africa and South Africa there is nowhere except for in Nairobi that can offer this new technology to patients who need it the most.
Transcatheter aortic valve replacement involves the insertion of an artificial valve through the groin to the heart in a procedure that lasts 2 hours.
So the reason why some patients should have TAVI and not conventional open heart surgery is, firstly, some patients are considered too risky for conventional heart surgery. In other words, the risk of the operation may be too high. The patient may suffer a heart attack or a stroke, or in fact to die at a higher chance from the open operation than from the TAVI.
However, doctors are optimistic to make full use of the new technology, with the procedure being cheaper in the country than in the US, where it was introduced 2 years back.
If you go to the US and ask for a TAVI, it will cost you between $80,000 and $100,000. We were able to do the TAVI here in Kenya for much cheaper, largely because we were able to secure good pricing on the valve, and also because as we introduce the technology, we want to make sure that it is accessible, that the team has a degree of comfort doing it, that it would retain this shape. It would, in other words,
what makes the procedure expensive is the artificial valve that has the ability to take its original shape after it has been introduced into the heart.
Over here, if you have a look over here and I put it in the hot water, it changes shape. With time, though, we're discovering that this technology is quite durable. And the important thing that we're also discovering is that even in the people who are very high risk for an open operation, their survival at the moment is better or is as good as the survival of people who are at low risk having an open operation.
However, the procedure is highly recommended for the elderly as compared to the young generation who can withstand the risk that come with open heart surgeries. Henry Minor, GBS News.